As after-school activities begin to start up, if you have a student athlete, it is so important to know just how common a concussion can be during a sports injury, especially during this National Concussion Awareness Week. Joining us now to share what parents and student athletes need to know about concussions is UT Physicians neuropsychologist Dr. Summer Ott, along with Chrysi Polydoros, whose daughter was treated for a concussion by Dr. Ott. Your daughter Mary was injured during a cheerleading stunt gone wrong. We'll get to that story in just a moment, but first, Dr. Ott, describe to us the signs and symptoms of a concussion.
Concussions can vary from person to person, but generally there's an immediate onset of symptoms that include things like headache, dizziness, balance issues, light sensitivity. But there are other instances where concussion symptoms may be delayed and not noticed by the individual until later that evening or the following day.
And when it comes to seeing a concussion specialist, why is it critical to see a specialist, and what can we expect through that process?
Well, I always mention to people, you wouldn't go to an orthopedic surgeon to treat your cardio injury or issue. So the same thing applies here. It's best to go with somebody who is well versed in the concussion literature. They're well aware of the research and the interventions, as well as ways to get people back to work and play safely.
And Chrysi, so your daughter Mary, a cheerleader, a flyer on the cheer team, so she was doing a lot of aerial stunts, and one day, essentially, she fell and hit her head.
Yes, she hit her head immediately within 10 minutes, had light sensitivity, nausea, went to the nurse, and we went to the doctor that day. And doctor was able to tell us what to look for, but after 2 weeks, she wasn't better. And a friend of mine in the medical field said, you need to go see Dr. Ott. And that's when we turned to Dr. Ott, who was able to tell us what to do once she was injured.
Sorry to jump in, Chrysi. Tell us a little bit more about what that treatment plan entailed with Dr. Ott.
Yes, it was a little bit of medication to help her. She had vestibular therapy. She had lots of different therapy. She had visual therapy. She had a prescription written for school on return to learn because the teachers didn't know exactly how to handle her delay in turning in work because she couldn't see a computer. So Dr. Ott was instrumental in helping Mary and my family regain our life for the 4 months it took for her to recover.
And she's doing okay today?
She's doing fantastic. She's fully recovered.
Okay, that's great news. And Dr. Ott, we're just about out of time, but no two concussions are alike, and that's why a tailored treatment plan is so important, right?
That's absolutely correct.
All right, well, thank you both so much for your time. And I think, again, as students are back in school, many of them participating in these activities, it is so important to note that even if it's a couple days later, it still could be a concussion. So thanks to you both for your time. And for more information, you can visit utphysicians.com or call 888-488-3627. And we will see you back at 3 p.m. Thanks, everybody.